Let's go over placing a 12-lead EKG. First off, know that electrodes are the stickers or buttons that the leads or wires will connect to. These stick to the patient's chest and body, where the leads are the wires and clips that will snap onto the electrodes or the stickers. If your leads snap on, start by snapping the leads to the electrodes. If they just clip on, you can just apply the electrodes first and we'll clip the leads on later. All right, now we're ready to start. Let's start with V1 and V2. These will go on the left and right side of the sternum at the 4th intercostal space. Try not to place these over bone. Now we're gonna skip to V4. The V4 electrode is placed on the 5th intercostal space, mid-clavicular line, which means the middle of the patient's left chest. A little pro tip is if your patient has breast tissue, the V3, V4, and V5 leads will likely be placed underneath the breast. The V6 lead is placed horizontally, equal to V4 but mid-axillary. This is straight down from the patient's axilla. Now let's place those leads we skipped. So V3 is placed midway between V2 and V4. And V5 is placed in line between V4 and V6. Now let's get ready to place the 4 limb leads. You want to look at the lead labels for placement to identify the left arm, left leg, and right leg. Now let's start with the arm leads. These can be placed anywhere on the upper arms between the shoulder and elbow. They should be positioned symmetrically on both sides, ideally on the upper bicep or deltoid for easy access above the patient's groin. Now leg leads can be positioned anywhere on the legs. Again, making sure they're symmetrical and avoiding placement over a bone. Now you're ready to begin your EKG. Happy studying, future nurses.